I know my face isn't in the video, but I was trying to get the best angle where you're able to see me applying the bag, so it'll have to do. But I did have to improvise because I did the journal and just discussed that I should also include in my journal of how to actually apply the bag. So I did already use my bag and I threw it away before deciding to do this, so I'll just have to improvise and we're gonna have to just imagine and we'll get the point. But I'm gonna use my study skills book to do this, and then afterwards I'm just gonna give a few points for changing or putting on that new bag. So I'd walk in, I did my hand hygiene, explain my procedure. I'm applying the colostomy bag, pull privacy. I'm gonna remove what's already on there. So I remove the old bag. We're gonna say it's already been removed, and the discard of it. It says when you take that off, you're gonna observe the stoma conditions in the surrounding skin and what the incision looks like. So you want to see if that stoma is it bright red color, or is it looking bluish and dried up and not looking moist. Then you're gonna cleanse the stoma and peristomal area. So I go ahead and I would just use like a warm water and mild soap so it doesn't irritate, and I would just clean around the stoma and I can get in the stoma. And then whatever ordered skincare I have for that stoma. And then also I would measure the skin barrier using a template. So I don't have a template on me, but I already measured out and cut my barrier to my stoma size. So this is what my barrier is going to be, and you can see I already cut around it to fit my stoma size. So then I would apply an adhesive paste around this opening so that way it would stick, and some of them already do have adhesive on them, like the one that we had was already in adhesive. So then I'm just going to apply that around my stoma. Give me 1 second. So we'll go ahead and it's just going to fit right around there. And I did watch a video. I know this is probably a little bit more room than they said, but you want to leave just a little bit of room around that stoma. So there you can see that. And then I'm going to put my pouch around the stoma. And it can be one of the two, which is a two-piece system where the pouch and the wafer are snapped together, or an adhesive backed one-piece pouch. So the one that we had was a snap together. The pouch just snapped to around where this hole would be, and then and then it was like an adhesive that stuck. So I'm just gonna act like this is a snap, and we're gonna put that bag on there. So there we have the stoma bag, if you can see that. And normally this bottom is going to be left open on the bag. And then you would have a clip that's going to fold over. So it's going to fold over, you'll fold over the clip and fold the bag over and then seal it off. And then the clip would come right down on that seal, or where that crease is, and it would clamp the bag and secure so that way nothing comes out. So then we said we fold the distal end of the drainable pouch and clamp it, remove our gloves, and then we document using correct format, the date and time of the procedure, state that we did the procedure, describe the stoma and the peristomal skin conditions, and describe the skincare that was done. So now I'm just going to, I'm gonna switch this over here. Okay. So, some of the things that you can educate just while the patient is cleaning or changing out their stoma bag. So before you begin to teach with the patient about changing the bag, you're gonna tell them all the necessary supplies they're gonna need. They're gonna need a template, moistened paper towels, washcloths, ostomy wipes. Special scissors are used actually to cut around that the wafer or the adhesive that make it a lot easier to cut that because it's thick and kind of like skin like. Okay. So if there is already an ostomy bag on there, removal, you're gonna gently remove the existing pouch. Some prefer slower, some prefer to do it quicker. You can do it in the shower, and then use a warm moistened paper towel or washcloth and gently push down on the skin while lifting on the corners of the pouch. Begin at the top and work down to capture any stool or urine that can be captured in the old pouch. And once it's removed, the pouch can be discarded and one of the disposable bags that companies might provide. And then you can examine that abdomen and the stoma around the skin and around the skin. Okay, so when you're going to clean that stoma, it can be, like I said, it can be done in the shower. And then you can rinse it with just plain tap water. If they're changing the pouch to the bathroom counter, you can use plain tap water, soap, or baby wipes. Once it's clean, the skin and the surrounding stoma should be completely dry. You can use fanning or a hair dryer on a cool will help dry the skin quickly. For when you put on the pouch, so we said you'll cut the opening after you found the correct size that you want for your stoma. And if it's a one-piece pouch, you want to be sure to pull the pouch away to prevent cutting into the plastic. The opening should match the size of the stoma, leaving no exposed skin. You can use soft paste strips, rings, or paste caulking that can be used at the cut edge to help seal the junction between the stoma and skin edges. The stoma paste is not an adhesive, but it's only for caulking. So you want to secure the prepare barrier onto the skin if a two-piece system is being used, and then you add the pouch. So if you have a new stoma and the area is tender, the pouch can be attached to the barrier before placing it onto the skin, and then encourage the patients to place their hand over the stoma and the appliance and apply light pressure for several minutes because it will help seal that. The frequency of the pouch changes. When a drainable pouch is being used, it should be changed every 3 to 7 days, depending on patient's preference, the type of stoma, the characteristics, and the type of pouch that's being used. Patients with low colostomy and regular form stools may opt for a closed end pouch that can be changed with each bowel movement. Normally it's once or twice a day. So regardless when the next schedule changes, patients need to be prepared to do immediate change for any burning or itching around the stoma, noticeable odor, or clear indication of a leak. And also, I watched a video and it said sometimes that the bags fill up with like air and gas, and it's just normal gas, and what you'll have to do is burp the bag. So what they do is they just they'll unclamp it and just let that air out if it doesn't have a filter. Some of the bags do have filters, so it just will automatically vent that out, and it's supposed to help with odor, but I mean, I don't know how much it really vents out with the really filters that odor. So I think that was everything, education and teaching how to apply the stoma.